Oh my gosh, should I do social media? And if I should, what do I put on it? Well, in this week's tip, we're going to talk about it. Okay, dental practices. You got a family practice and you're like, well, should I get on to Facebook and Instagram and do I bother with TikTok? And if I do, what do I do there? Great questions. My name's Dan Brown, and I am the Senior Service Consultant here at MGE Management Experts. I'm also kind of the resident marketing specialist for the group, and I help our clients move from insurance-based practices over to a fee-for-service type practice. And if you're interested in being the practice that services people who care more about their treatment and that experience than they do what the insurance covers, well, then you're in the right spot. We're going to talk today about social media. Get a lot of questions about this all the time. Should I do social media? Well, the answer to that question pretty much unconditionally is yes. Now, I know a lot of you. That's not who we are, and I'm not the dancing dentist, and I'm not trying to turn you into the dancing dentist. But social media is being used by so many people that I can't advise you otherwise. Now, we're going to talk about where to start. We're going to talk about what to do. We're going to talk about what not to do. But I am going to tell you this, whatever idea you might have, that might be a bit of a fixed idea. You think, well, we don't want kids in here and we don't want people who are just, tire kickers. They're just coming in to shop us. Well, that's going to be out there in whatever marketing channel you choose. You're always going to get some people who are not a good fit for your practice. But there are a lot of people out there, including my 84-year-old mother, who is on Facebook. Why? Because that's how she sees her grandkids every day. And she spends a lot of time on Facebook. And we have a number of our clients who are getting so many patients from social media. Well, if it's done right, it's going to work. So let's talk about the channels. Which ones? Well, first, it should be Facebook. Next, it should be Instagram. Why? Well, Facebook is now Meta. Meta owns Facebook and Instagram and WhatsApp, just so you know. So you can post to Facebook and Instagram by the same click of the button. So that's nice. Then we're going to talk about a YouTube channel. You should have a YouTube channel. People say, well, why do I want a YouTube channel? I'm not trying to be like you guys at MGE doing all these videos. No, we're not trying to get you to be like us. But your testimonials, do you have them? If not, you should. And lots of them. We'll tell you how to do that. Also, doctors, people do want to meet you, and they want to meet you virtually before they meet you actually. I've done so many studies to find out, what do patients do before they pick up the phone and call you? Well, here's what they do. Dentist near me. Oh, look at that. Google reviews. Good. Okay, good. Check into their Google business profile. That's a social media channel. Oh, look at the photos. There's 2 photos. There's Street View from Google Car, right? The Google car that drives around and sees takes a picture of the front of your building. And it's even got the wrong picture, right? It's got the back of your building with a dumpster next to it. And then they see the picture of, something a patient put up. And it could be their Thanksgiving dinner, because anybody can put any photo up and even accidentally post the wrong photo. So that's a great place to have a lot of great photos, even some video content. We'll show you about that and a bunch of other things in our new patient workshop. Way too much to put in a tip here, but we do a 2-day online workshop. It's a Zoom-based workshop, so you can do it from your practice or from your home. It's cheap, and it's guaranteed for 6 months after you do it, money back guarantee, nothing to lose, everything to gain. I'd highly recommend it. We'll put a link down here so you can check out the information on that workshop. But here's the thing, Google, and then they look at you and they go, okay, good, yeah, pretty good. Let's check them out. They check out your website. Sometimes they'll go straight to your Facebook page, and then they'll go to your Instagram page. And they might even check out your TikTok page. And they might go check out your YouTube testimonials and some doctor content. Hi, my name's Dr. Jones. I'm going to talk to you about a commonly asked question. Should I do Invisalign or should I do traditional orthodontics, metal braces? We're going to talk about that today. Doctor, you might not be comfortable talking about those things, but guess what? When you walk into that operatory, you have those discussions every single day. I want you to look at the camera, just like I'm looking at the camera, and talk to a patient, just like I'm talking to you right now. And yeah, the first few videos might be a bit rough. Hi, my name is Dr. What's my name? Right, it's going to be a little bit nervous, right? You get on the other side of that, and after 3, 4 videos, just look at that lens like it's a patient who just asked you, should I do Invisalign or clear aligner therapy, or should I do traditional orthodontics? What's the difference? Should I do an implant or a traditional bridge? What are veneers? And are veneers permanent? Are implants permanent? What's the difference between a denture and, a traditional bridge or a dental implant? You need to go through these things, and that's on your YouTube channel. Doctor, I do understand that you might be sitting there, I'm not that person. Or even worse, I don't know, I need to lose a little weight, my hair, my makeup, and I'll do it someday. You don't think about those things when you walk into that operatory and you talk to that patient, do you? No, you just walk in there and you talk to that patient, don't you? Yes, you do, every single day. So just do it on camera. Answer the most common questions you get asked. And if you don't know what they are because you freeze when you start looking into the one-eyed monster called a camera, I've done it, I know, I've frozen. If that happens, just write down, oh, I got that question, that's a good question, I should take that one up on video. Oh, that's another good one. Oh, that's another one. You'll have 10 in like a week or less. Good, that's your subjects. Keep them to about 3 to 5 minutes. You're gonna see I drone on and drone on. This 3-minute tip turns into like an 8-minute tip, right? You will see the same thing happens to you. So your YouTube channel, and they're checking this out. What's it like? What they're doing is they're traveling virtually into your practice. They want to meet your team. They want to see how you are with patients. They want to make sure that you're not going to shame them when they walk into the practice. You're not going to go, you have not kept your teeth that clean, have you? Yuck. You peasant of a patient. They don't want that. And they get to meet you and they go, oh, kind of a nice person. Oh, seems pretty competent. Oh, seems friendly. Seems like I'm not going to be shamed there. Seems like the best time to go see a dentist, well, would have been 5 years ago when I should have gone. And the next best time is, today. That's what the doctor just said. And, doctor's got a point. I'm going to go in. So they're checking you out. The number of patients that come into our client's practice from having seen testimonial videos, we call those explainer videos by the doctor, explainer videos, before and after photos, culture content. Hey, we had our patient here, Jim Jenkins just came in and brought his 2 boys, and his boy just got a full ride scholarship to blah, blah university. Big shout out to this family. What a great family. If you need a new roof, talk to Jim. He's got a roofing company. It's awesome. What does that have to do with dentistry? Not a whole bunch. What does it have to do with family dentistry? A whole bunch. You start creating some culture like that. People go, oh, I like this practice. This is a good practice. I like these people. They're real people. We have a whole series of tips like this. I want you to go ahead and hit the subscribe button down there. And I want you to enable all notifications because we're going to let you know when a new one comes out. And if you've got something you want to know specifically about, we'll put it in the comment down there and we'll take it up just for you. Give us a try. Put a comment in there. I'd like to know more about blah, blah, or I hate TikTok. And, we'll probably give you an amen on that one. But TikTok is bringing in patients for our clients. So we'll show you how to use that if you want to go there. But it's Facebook first, Instagram, YouTube, and then TikTok. From there, and I do want to actually back up. Those are the 4. I want to back up one, and that's your Google business profile. Is it a social media channel? Not formally. Is it a powerful marketing channel? Absolutely. It's top of the list. So, and there's lots of things coming out that you're going to have to be aware of. We'll keep you abreast of all the new changes and things. But those are the social media channels. I'm going to tell you what to post and what not to post. What to post. Good news, feel good stuff, motivation, happiness, successes, before and after photos, patient successes, like in their life, not just in your chair, in their life. Feature them. It's social media. It's not me media, right? We don't like when we see on social media, everybody's like, oh, hi. We hate that, right? We all hate that. Well, that's because that person thinks it's me media, and it's not me media. It's social media. So be social. Talk about the local business down the street that does great sandwiches, or, and talk about the owners and feature them. That's great stuff. This is what you do in life, I'm almost certain, every single day. Now I just want you to record it. And I want you to take pictures of it. And I want you to talk about it. And if you need some help on that, again, we've got our workshop. We'll walk you through that, exactly what to do, how to make it easy, how to start, and then go a little bit deeper and a little bit deeper. So that's what to post. What not to post. Hot topics, man. Stay away from hot topics. You know, you may be in the United States, Canada, or another free country, and we should all celebrate that freedom. Freedom of opinion, thought, feeling, expression, speech, all those things. This, however, is your social media channel for your dental practice. This is not where you should be very opinionated about certain hot topics that you are welcome to be very opinionated about, but which I do not recommend that you do so publicly on your social media channels for your practice. So, just like at MGE, we don't care if you are religious or what religion you are in. We don't care about race. We don't care about, relationships, and that's none of our business. If you are a great dentist and a good person and you just need help with management stuff, well, we're going to take care of you, just like you. If the patient walks in and they're nice to your team and they want some help and they're willing to get, some direction from you as a doctor, yeah, you're going to take care of them. You don't care who they voted for or this or that or the other thing. That's none of your business. So if that is of your mind, well, please, I would stick with that on your social media channels. I would stay away from hot topics. Like I said, be as passionate as you so choose about that in your private life and keep that private. On your public-facing personality, well, I want you to think about the things that is inspirational. They're inspirational and they're hopeful and they're positive. So those are some things to stay away from. These are the things to do. Again, we're going to cover all this stuff more extensively in our new patient workshop, but I hope that helps for now. My name's Dan Brown, and if you need any help, you reach out to us. We will absolutely take up your practice, your specific position independently. It's part of an analysis we do here at MGE. So I hope this has been a helpful tip. If you like this content, if this has been helpful, go ahead and hit the subscribe button down there and, hit the like button if you wouldn't mind, but enable all notifications. What that does is it tells you when we come out with another video, and I got a bunch of great stuff coming. So stay tuned for that. And if you have any questions, reach out to us. Otherwise, we'll see you in the next tip.